You know, my heart is absolutely full this evening, and it is a joy to be able to sponsor tonight's mayoral forum. My name is Afia Atamensa, and I have the privilege of serving as the Director of Community Voices Heard and Community Voices Heard Power. CVH is a base building institution. For 26 years, we have been building power in low income and working class communities and Black and Latinx communities across New York State. We started our Follow Black Women Survey project in 2019, seeking to survey Black women across New York to ask the crazy question, what issues most matter to you? And to move from the survey tool to an organizing model that brings together Black women across issues of ethnicity, religion, age, and education to build relationships and, most importantly, demands for what our communities need. For me, Follow Black Women is not just a slogan, it's a way of life. See, all my life, I have been loved by, led by, taught by, held accountable by, and directed by Black women. And I know that that is the same for many of you who are with us tonight. For some time, we've seen people perform in appreciation of Black women or perform support of Black women's leadership. At Community Voices Heard, we believe that support of the leadership of Black women is better seen than said. We should be able to feel it in deed and not just in word. That support, that respect, I'm an organizer, so I would say that recognition is made real by policy priorities, in budget commitments, and in staffing. In New York City, just like in many other communities across the country, Black women are in fact the margin of votes needed to win an election. And I have it on good authority that Black women intend to show up and show out in this primary election. And we will have something to say about who gets the privilege of living in Gracie Mansion. And so to us, it only made sense that there should be a forum created for and by Black women. Our communities are not a monolith. There is no one answer that is going to magically conjure the Black women vote. We are sisters, daughters, mothers, essential workers, providers, but most importantly, we are New Yorkers, and we help build this city. So I'm so glad that CVH can be a part of bringing together the first, but hopefully not the last, mayoral forum that focuses on Black women. So before we get started and I introduce our esteemed moderator, Dr. Christina Greer, I want to make sure that the folks at home, my viewers tonight, are doing okay. So please answer some of the following questions so we can get started. Where are you from? Which borough do you live in? Go ahead and fill out the poll. Now, I'm coming to you tonight from God's country, otherwise known as the Village of Harlem, but you guys put where you're from. Our second question for viewers, what issue topics are you most interested in hearing about tonight? Please take a moment and fill in that poll, and we'll get back to you with those numbers. So I'm happy to report that we're more than 230 strong so far tonight, and we're just getting started. So we're going to have questions from both our esteemed moderator and a panel of members, Black women who live across New York City. We're asking for those who are on social media, if you want to tag about this, please feel free. Hashtag it is Follow Black Women. And without further delay, I want to introduce our esteemed scholar and my dear friend, Dr. Christina Greer. Dr. Greer is an assistant professor of political science at Fordham University Lincoln Center. Her research and teaching focuses on American politics, Black ethnic politics, urban politics, New York City, New York State politics. She is the author of the book Black Ethnics, Race, Immigration, and the Pursuit of the American Dream. You've also seen Dr. Greer as a regular contributor on New York One and MSNBC. She is the politics editor on thegrio.com. And if that isn't enough, Dr. Greer has a new book coming out soon on Black women of the South, Fannie Lou Hamer, Barbara Jordan, and Stacey Adams. And without further ado, please join me in welcoming our esteemed moderator for tonight, Dr. Christina Greer.
Thank you so much, Afia. Now, I'm only going to correct you and say associate professor because you were there when I celebrated tenure. So that's an old bio. I want to thank all of our guests this evening. I especially want to thank our candidates. I know you all have been doing forum after forum, but it's only getting you prepared for the 30-hour-a-day job that is mayor of New York City. So I'm very looking forward to hearing what you have to say. And this event is centered around Black women. And as Afia said, Community Voices Heard Power is a multiracial member-led organization that focuses specifically on grassroots political organizing, and they're working to change systems and shape policies that ensure racial, social, and economic justice for all New Yorkers. So it's no more fitting place than obviously CVH to host this particular forum. They are seeking to politically educate, train, encourage, and support aspiring candidates of color, as well as individuals who support their agenda to advance low-income communities of color across 4 chapters in New York City, Westchester County, Orange County, and Dutchess County. And so I ask of all of our candidates this evening, please center your opening statements around the theme of Black women and the mission of Community Voices Heard. So we've selected several topics for this evening and different themes that are based on some of the surveys that they've conducted and crowdsourced certain questions. Some questions will be asked of all candidates, and some questions will only be asked of specific candidates who will be assigned certain questions for more focused discussion. So I ask of you this evening, each candidate will have 90 seconds for your opening statements. I'm going to repeat that for some of the chatty Cathys. You will have 90 seconds for your opening statement, and it must address Black women and our issues. Stump speeches out the window. You can speak from the head and you can speak from the heart. I do have the mute button in my capacity, and so hopefully we won't have to use it this evening, but we've also chosen the order at random. So I'm going to give you all the order. Diane Morales, you were selected to go first, but the order for this particular opening statement set of questions is Diane Morales, then Andrew Yang, Amaya Wiley, Ray Mcguire, Shawn Donovan, Scott Stringer, and Eric Adams. I want to thank all of you for coming, and I'm going to turn it over first to Diane Morales.
Thank you so much, Christina. My opening statement is relevant to Black women because I am a Black woman, and so everything that I have to say is connected to that. My name's Diane Morales. I was born and raised in Bed-Stuy as the proud daughter of Puerto Rican parents, single mother of 2 children, both of whom have learning differences and attended the public school system. I'm also the only candidate who has been an educator in the New York City public school system. I'm a proud Afro-Latina. For over 25 years, I've spent my career managing large human service organizations because the city's leadership continues to fail the needs of our people, of women, children, Black and brown people, queer people. The time is now, I believe, for us to have those that are closest to the problems drive the solutions. And I'm excited to be able to speak with you about that today. Buenas tardes, mi nombre es Diane Morales. Fui nacida y criada aquí en Bed-Stuy. Soy hija afro-latina orgullosa de padres puertorriqueños. Soy madre soltera de 2 hijos con necesidades especiales y soy la única candidata que ha sido maestra en las escuelas públicas en la ciudad de Nueva York. Por más de 25 años he sido ejecutiva de organizaciones de servicios humanos porque el liderazgo de la ciudad nos sigue fallando.
Fine.
Los últimos 109 alcaldes.
All right, thank you so much. Andrew Yang, 90 seconds to introduce yourself. Welcome.
Thank you, Professor Greer. Thank you, CVH, for the incredible work you do. I think that Afia hit the nail on the head, which is we all know that elections are won or lost on the backs of Black women. And then the question is, what changes? If nothing changes, then we have failed. You can look at what happened in Georgia, where we all know that we owe, in some ways, our very democracy to Stacey Abrams, LaTosha Brown, and the Black women who helped activate the voters of Georgia. I am totally sure that the next mayor is going to be determined by Black women voters here in New York City. The question is, what will change? How are we going to make things better over the next 4 years when we know that Black women have lost jobs at higher levels, lost their lives at higher levels because of COVID, are dying in childbirth at 8 times the level of white women in New York City? We need to fundamentally change the way that things are working here in New York City. And that is why I'm running for mayor. I have a comprehensive anti-poverty agenda, including $1 billion in cash relief, trying to get high-speed internet to the 29% of New Yorkers who don't have it, which we know is disproportionately households of color, and get the 12% of New Yorkers who don't have bank accounts and are getting exploited by check cashers, money lenders, and pawn shops to actually get safe bank accounts so you can save the money that you work so hard to earn. We have to change things fundamentally, and you are going to lead us there.
Thank you. Next up is Amaya Wiley.
Thank you. And I first want to start by thanking and recognizing every last one of you, and particularly Afia, who has been a leader who has inspired me, as well as the rest of us, as have you, Christina Greer. But let me just start by saying I've been Black all my life. And that included when I was a little girl in a segregated, underfunded, overcrowded public school. And it was when I watched my best friend, Charlene, whose mother was a cashier at our neighborhood grocery store, disappear one day. And she did that because when the rent was increased, her mother could not afford it, even though I knew how long the hours were that she worked. And that was the beginning of the trauma of watching my community start to disappear. So I went to Columbia Law School to become a civil rights lawyer as the daughter of civil rights activists, as the daughter of George Wiley, who created for me and for my brother a family of powerful Black women who, at the forefront of the economic justice movement, said it is Black women who are too often treated like the pack mules instead of the precious cargo, and fought for a guaranteed income so that women who are Black could be seen and heard in their demand to be seen as mothers, as caretakers, and to have that work valued. So I am running not just as a civil rights lawyer and a lifetime racial justice advocate. I am running because I believe that it is our dignity. And that means dignity in our communities. Dignity means development without displacement.
Thank you, Maya. Next up, we'll have Ray Mcguire.
Thank you, Professor Greer and Afia. I'm so honored to be here. I am the product of a 94-year-old, and if Grace is with us on Sunday, 95-year-old Black mother. I'm running for mayor because New York is in crisis. New York needs leadership that meets this moment. Black women have been the hardest hit by a current crisis. They serve as frontline workers who are exposed to the virus daily. Black women are the head of households. They bring in less money than their counterparts while providing for all the care during multiple generations. And I have a history and a track record that says if you invest in Black women, you invest in Black communities as a whole, you invest in this city. My vision for this city, including pouring money into and investments into the vessels that poured into me, so our city can recover and heal. All this is dependent upon that Black woman who was a social worker who raised me and my two brothers on the wrong side of the tracks. And based on her sacrifices, I'm able to be here, and I'm able to present myself as a leader who can meet the moment, who can lead this city forward in the most inclusive economic recovery that the city has ever encountered. And at the base of that is Black women. Thank you for having me.
Thank you. Next up, we have Shawn Donovan.
Thank you, Professor, to Afia, to everyone at CVH. Thank you for having us here tonight. Thank you for your leadership. I became a public servant because I grew up in this city at a different time of crisis. I watched homelessness exploding on our streets. I watched neighborhoods like the South Bronx and Central Brooklyn crumbling, literally burning to the ground. And it lit a fire in me to go to work on behalf of this city that I love. In college, I heard about an amazing group called East Brooklyn Congregations and a leader named Bishop Johnny Ray Youngblood. And I asked him to put me to work. And I began rebuilding those neighborhoods with the Nehemiah Plan to give primarily Black women moving directly out of public housing their first chance at buying a home and building wealth and rebuilding their communities. That began a 30-year career on the front lines of housing and homelessness, of racial and economic justice, that led me to be housing commissioner in this city in the wake of 9/11, housing secretary in the midst of the worst housing crisis of our lifetimes that destroyed 2/3 of Black wealth in this country, and to lead this city back after Sandy hit, and primarily preyed on so many low-income Black and brown communities around this city. I understand that we need a leader who knows that in moments of crisis, we need to repair, rebuild, and reimagine the city as a city that works for everyone. Thank you.
Thank you. Next up, we have Scott Stringer.
Well, good evening, everybody. And I too want to thank Athea and Dr. Greer from Community Voices Heard for hosting this very important conversation. And I do want to start out by acknowledging Amaya Wiley and Diane Morales, two colleagues who have traveled a road that I have not. They're bringing their lived experience to this race, and I think we're all better for it. Look, I don't have to tell anyone in the Zoom tonight, we are at a critical moment in our city's history. The next 4 years will shape the next quarter century. And if we want to have a real and equitable economic recovery, we need to have Black women front and center in our policy making. Because the best measure of our success as a city is the success of Black women in our city. And we all know this, Black women are and have always been the backbone of communities across this country, from Atlanta to Atlantic Avenue. So it's time for a mayor who will back up words with concrete policies and actions. We also need measurable results. And I offer my candidacy because I have the skills and experience to help deliver change for Black women and all New Yorkers starting on day one. You know, I've been proud to stand with all of you at CVH for years. In the borough president's office, we took to the streets to defend NYCHA residents and stand up for tenants. And as controller, I sat with you in your office as I developed my affordable housing plan. I joined with you in your office again when we came together to imagine what a childcare revolution would look like in our city, recognizing that there can be no economic justice for Black families without investing in our children and the workers who care.
And time. All right, thank you, Scott Stringer. And last but not least, from the great borough of Brooklyn, Eric Adams.
Thank you, and I'm loving you with that stopwatch. You know, when we have this conversation about Black women, and I benchmark every moment of my life, that's what I see throughout my entire day. I attended a small storefront church growing up in South Jamaica, Queens, although I was born in Brooklyn. And we used to go at night, go home during the day, and then come back in the evening. We used to call it the Cheers Church. Everyone knew your name and everyone was glad you came. We never had an opportunity to eat during the break in service because mommy was raising 6 children at the time, 4 boys. And I'll never forget one evening, a car caravan of Black women pulled up at our home. They had started unloading boxes of groceries and placed it on our countertop. They prayed with us. And I went downstairs that evening and looked into the boxes because at last we were going to have milk and not that powdered stuff. But everything in the boxes, they were open. Half a box of spaghetti, half a box of rice. Those mothers and women could not afford to buy us food. They gave us half of what they had. And that's what I know about Black women. They were in front of my house when someone shot up my car, and I didn't even know them. They were praying for me and hoping my safety. They've been with me throughout my entire life. And so when I define my relationship with Black women, I am who I am because of Black women.
Thank you so much. And I thank all of you for maintaining the time. I'm trying to get you all out of here at a decent hour so you can enjoy your families. And we so appreciate you taking the time to spend this evening with CVH and answer these important questions. This next round of questions will be for all of you. So CVH has selected 5 members to represent key topics reflected in the Follow Black Women survey and in crowdsourced questions. So in the interest of time, we've pre-selected which candidates will respond to specific questions. Candidates will have 2 minutes to answer the question, and we will call time after 2 minutes and/or hit mute. And then after we go through our questions from our CVH members, and I'll ask a few questions myself, to mix things up, we'll have a lightning round at the very end where all candidates will have an opportunity to respond. And so this first question is for all candidates. And this question is from CVH member Cheryl Watts, and it will address healthcare. Cheryl, welcome.
Thank you, Professor Greer.
Thank you.
How are the candidates? I hope you are well. As we know, healthcare is not equitable. Yet for Black women, it is especially not equitable. Some years ago, I experienced what a lot of Black women experience, which is observing something is wrong with me physically, and then going to numerous doctors and hospitals and being told that there's nothing wrong or I should just get some rest. I know of repeated examples where Black women have requested help with investigating a health issue and are dismissed until the problem has grown and become life-threatening. It is statistically proven Black women are treated less and receive less time in the presence of their physicians compared to our female counterparts of different ethnicities during medical encounters. Rather than clinical treatment, we receive assumptions and or stereotypes that mask it as medical treatment. As mayor, you will have under your control the largest healthcare system in the nation, which is the Health and Hospital Corporation. What would you do as mayor to make sure that quality medical treatment and accessibility is accessible and equitable for Black women? First up is Eric Adams.
Thank you. I just want to make sure my mute is off. I'm sorry. Thank you very much. Important topic. I'll never forget the day sitting down watching mommy inject herself with insulin and grimacing after injecting herself. Little did I know, 6 months later, I too would lose my sight in my left eye. I was told I was going to go blind in a year. I had permanent nerve damage in my hands and feet that was going to lead to amputation. They actually stated that there was nothing they could do for me. And I was determined to do something different and approach the healthcare crises that's impacting the Black and brown communities. The numbers are clear on how we're being treated once we get inside the hospitals. We must have a health revolution in this city and in this country, to be exact. Number one, I just finished a book on this topic, talking about how our mothers and sisters and grandmothers are not receiving some of the tests that others receive. The fact that Black mothers die 12 times the rate of white women from maternal morbidity, and how we are automatically treating symptoms and not underlying causes. Once I made a lifestyle change, I was able to regain my sight, was able to put my diabetes in remission and all my nerve damage. My 82-year-old mother, after doing the same, mom is now off her insulin and she has regained her health in the 9 medications. They are pumping our communities with drugs and with treating symptoms and not solutions. The real drug deal is not the guy standing on the corner. It's the 3-piece suit pharmaceutical industry that they have our families hooked on drugs. I have a program at Bellevue Hospital, the first of its kind in America, which lifestyle medicine is being treated. We are reversing and helping people how to reverse their chronic diseases. I'm going to use H&H to be the symbol of America's healthcare system improvement.
Thank you.
Ray Mcguire, the same question, please.
Thank you. You have outlined what clearly is one of the biggest crises that we have. And when it comes to health and healthcare, my top priority is ensuring that there is true equity and affordability in this city. In the short term, we need to make certain that people are connected to primary care in their neighborhood. Too many of us live in healthcare deserts. We need to have a relationship with a good healthcare provider beyond this pandemic. And what this pandemic has outlined is, quite candidly, we don't have those relationships. So I will invest in primary care health facilities. Health and hospitals is important. It's an $8 billion budget that now has got a $2.5 billion deficit, serving 5 to 6 million people. It is the go-to for many of our New Yorkers. We need to invest in and repair that. But in addition to that, we need to make certain that we create primary care facilities in the neighborhoods where people have access to the healthcare so that they don't get misdiagnosed. They recognize and can acknowledge the fact that they have someone in the community that is focused on their healthcare. I will work to make certain that we increase the investment in public hospitals and healthcare centers, which is going to make it more affordable. And we need to look across the system to make certain that the system is equitable when it comes to treatment. You can't go to one healthcare facility and get one price and go to another healthcare facility and get another price. So we need to make it much more equitable. And I will make certain that I look to create equity across the system and make certain that in addition to investing in health and hospitals, that we create primary care facilities in the healthcare deserts and take healthcare to the people in the communities. And that's my plan. And that's how I focus on it. There's nothing that creates a higher level of prioritization than this. We need to overhaul the system to make certain that we take it directly to Black women and Black families, which today we're not getting.
Thank you. Diane Morales, same question.
Thanks so much for this really important question. This is really personal for me, actually. I've had two experiences in my lifetime where I was rushed into emergency surgery as a result of not getting medical treatment when I needed it, despite repeatedly saying that something was wrong. And the second time I almost died. And so I have firsthand experience with exactly what you're talking about. And I understand that we are also subjected to 3 to 4 times the mortality rates to our white counterparts, even when our socioeconomics are the same. So, one of the things that I have emphasized and think is important is for us to increase access to local integrated community health clinics that focus on education and prevention first, so that our communities have access to the information that they need and the care that they need before a crisis. And that care needs to be provided in culturally and linguistically appropriate ways by people that look like us and come from our communities and are prepared to actually care for us. So I think that's a critical piece. I also think we need to look at really hard how we prioritize training medical teams on inequities in healthcare and mitigating bias, and hold professionals accountable in these instances, so that they are not treating us in the way that they have treated us for centuries without any kind of repercussions. I also think we need to involve community-based organizations in the implementation of training programs for people that look like us to increase their entry into the field, no matter what the profession is. We know the healthcare profession is vast. And also I would say that, we need to hold, again, doctors accountable, whether we're birthing or not, right? We need to invest in doula programs and training programs. It takes a village not only to raise our children, but to protect our women as well.
Thank you. And last but not least, Ms. Amaya Wiley.
Maya, you're muted.
You're muted.
Thank you. COVID verse. Look, I heard your question. Ms. Watts, your question was about racism in the system. That is our healthcare system as a system. So it starts with, I won't blame Black women. I won't talk about what Black women have to do differently. I will absolutely have our Department of Health and H&H track the data, make it public, and hold folks accountable when their numbers don't add up. Because what you just said is the numbers don't add up, because it doesn't when you have 12 times the rate of mortality for Black women in childcare. It does not add up if you are not getting pain medication when you're in pain. It does not add up if you are like Rana Mungin, who is a teacher, one of our teachers here in Brooklyn, who asked twice to be tested for COVID, and she kept getting told no, because she was 30 years old and she's dead from COVID. So here's the thing. We're going to not only collect and track it, we're going to make it public, and we are going to hold it accountable, because there will be consequences when those numbers don't add up. And the other thing, because I worked on access to healthcare as a civil rights attorney, and I can tell you the other thing that is true is if you are Black and female, you are much more likely not even to have health insurance. That's important because the health insurance gives you choices. The health insurance, it is not that it is the only answer. As I think Diane said so accurately, even across race, we saw Serena Williams struggle with the system, and she had money. But it does matter that we don't have health insurance. 14% of Black women compared to 8% of white women. So I'm working on a plan to fix that too.
Thank you. Back to you, Professor Greer.
Well, Cheryl, I believe for this particular question, it's all the candidates. So we still have to hear from Shawn Donovan and then Andrew Yang and then Scott Stringer. So I'll turn it back over to you, Cheryl.
Okay, Mr. Scott Stringer.
Thank you very much. You know, in April at the height of COVID, my mom, 86 years old with pre-existing health conditions, died in a Bronx hospital. And I remember when she died, the doctor saying to me very clearly that while your mom passed away, you have to understand that COVID is exposing the systemic racial policies of this city, because COVID went to the most vulnerable, Black people with pre-existing conditions who were 50 years old, Latino people dying at 40 years old. You see, this whole system has been geared not to solve health crises, but to simply manage them. And COVID said, we cannot manage anymore the system that is so discriminatory. And it, for me, starts with something the mayor can do something about. It's called land use and zoning in healthcare. The truth is that a lot of these pre-existing health conditions started decades ago. It started with peaker plants and bus depot stations that were put in Black and brown communities where Black mothers were raising children. And that's where the asthma started and other health conditions. So the next mayor has to stop this notion that developers and city agencies dump everything in communities that have already been marginalized. And I'm going to stop that on day one. The other thing is we have to expand healthcare options. When I was Manhattan Borough President, I was proud as our Go Green initiative to build a standalone asthma center to give moms the opportunity to help their children because they didn't want to go to the hospitals. And I do want to create community-based healthcare, but I also want to build personnel. We need more Black doctors. We need more Black health professionals. And the way to do that is to access CUNY and create programs to keep people in the communities that are doing the medical work. That's affordable housing, that's stipends, and that's creating a workforce that can do that. And finally, we do have to recognize that Black women.
Thank you.
Got it.
Mr. Shawn Donovan.
Thank you, Cheryl. Three big things I think we need to do here. First, we have to recognize that every issue, every agency that touches healthcare, but also our neighborhoods, has to be held accountable. That's why the very first policy I announced when I said I was running for mayor is that I would have a chief equity officer reporting directly to me so that that chief equity officer would have power to hold agencies accountable, not just H&H, but our health department, our parks department, every single agency that has control of things that affect people's healthcare. Second, Maya's exactly right. Black women disproportionately don't have access to health insurance. That's why I've proposed creating a true public option. I would work with my close relationships in the Biden and Harris administration to make sure we're getting the help from Washington to help pay for that. But also, it's not just about access to the healthcare, it's access to culturally appropriate doctors and in your neighborhood that actually can help you get the care that you deserve, that's unbiased, and will pay attention to the underlying challenges that you described a few minutes ago. The way I would do that is through what I call my 15-minute neighborhoods. Every New Yorker should have within 15 minutes of their front door access to not only transportation and jobs, but also to primary health care. My public option would allow you to choose not just an H&H doctor, but a doctor you trust in your community under the public option so that you're not forced to go to H&H. And I would make sure that in your community, you had prenatal care, mental health care, all of the services that you deserve, as well as things that would get to the underlying health disparities that we see are disproportionately devastating Black communities, fresh food, parks, and all the other things as well.
Thank you. And last, Andrew Yang.
Thank you for this question, Cheryl. Healthcare providers don't listen to women, they don't listen to Black people, and they certainly don't listen to Black women. That is why that we are having this conversation, and it's deeply painful. So what can we do about it? Number one, we should amend the city charter to reduce and end racial disparities and have the DOHMH and New York hospitals have it actually baked into their DNA. This should be the mission of New York City. Reduce racial disparities in healthcare outcomes. And the disparities are so vast right now that you can actually do a lot of good quite quickly. The second thing is you need to have more healthcare providers who are either trained to listen to Black women or are Black women themselves or of the community themselves, so they're actually responsive to you. The third thing is it's very, very difficult to advocate for yourself when you're unwell, when you're struggling. There's a power dynamic imbalance. And I know this in part because my wife was preyed upon by her doctor. So what we need to do is we need to get champions for Black women into the healthcare system, like midwives and doulas, who can fight for you when you cannot fight for yourself. We need to have more advocates alongside you in that hospital so that when the healthcare provider is saying you're fine, they'll be like, no, she is not fine. She needs help. And again, the mission of the city needs to be to end these disparities because they're completely evil. They are wrong.
Thank you very much for that answer. And now back to you, Professor Greer.
Thank you so much, Cheryl. This second question is for, again, all of the candidates to answer. And this next question comes from CBH member Samaya Abdul Salam, who will be addressing COVID and the distribution of vaccine in communities of color. Samaya?
Sorry, I had to mute. Thank you so much, Professor Greer. And thank you so much, Cheryl. I'm so happy that we started this conversation talking about healthcare. So we know the COVID-19 pandemic has disproportionately affected Black and Brown communities, communities who the healthcare system has historically neglected, as we just discussed, and who continue to work on the front lines of the pandemic as nurses, as transit workers, teachers, school staff, and are the faces of essential services. My grandfather is an essential worker at an elementary school in the Bronx. As a senior and an essential worker, he is also eligible to get the COVID vaccine, but has struggled to find adequate information and resources. Meanwhile, news reports have highlighted how non-minorities from outside New York City have been able to have access to vaccines in large numbers. And we know this is unfair. As his granddaughter, and as is tradition in my family, women often carry the burden of finding resources to support their families. It is discouraging, to say the least, that our seniors and high-risk community members are struggling to secure appointments to get vaccinated and are being asked to risk their health by traveling to sites that are far away from their immediate neighborhoods, if they can even obtain appointments. As mayor, what will you do to ensure that there's equitable vaccine distribution for Black women working on the front lines, for Black seniors working on the front lines, and what will you do to provide adequate information on vaccine distribution for our communities? Let's start with Shawn Donovan.
Thank you. You know, unfortunately, having led through so many different crises, hurricanes, housing crises, and so many others, I was outraged, but not surprised that COVID has disproportionately devastated Black and Brown communities. I've seen it over and over again that those who are most vulnerable before a crisis hits are always hurt the worst by it. And so we must change our immediate response and make sure that we are providing vaccines much more equitably in this city, but we also must attack the underlying disparities in our healthcare system that have led to these disparities over and over again. And so on the immediate issue, I would make sure, first of all, that we are fundamentally reorienting our system, providing mobile vaccine provision in deep partnership with community organizations that know that if a senior doesn't have access to an iPad, if a undocumented immigrant is afraid to go to a website and provide personal information, that we are partnering with them to ensure that they can get registered and that we have vaccines available in their communities in a way that is profoundly different from what we are seeing today. So we need to reorient that system in true partnership with the kind of community development organizations that I've worked with for the past 30 years in New York. I know that we can reach them. I built a system to reach them with food during the crisis, But at the same time, we have to attack the underlying disparities. I said a moment ago, I would reorient all our planning toward 15-minute neighborhoods. Every New Yorker, regardless of what they look like, what their language they speak, who they worship, should have access to primary health care, to testing, and to vaccinations at facilities in their neighborhood, period.
Time. Thank you.
Much. Eric Adams.
Unmute.
Yes, thank you. We need to really dig into this because I say this over and over again. How do we define crises? We don't define crises when the victim of that crisis is really Black and brown people. Same thing with when crack was rampant in our community, we ignored it until opioid went to the suburban counties. When you look at the rate of Black women dying from maternal morbidity, we ignore it. Gun violence, it wasn't until it was in the suburban counties, we said we had a crisis. That is what's happening in COVID. When COVID hit this city, some people fled, I led. I put a mattress on the floor at Borough Hall and I slept there for 4 months. I didn't stay inside the Hamptons. I went to public housing. I went to hospitals, delivered food, and I talked about the fact we were not testing Black and brown people in the city. Jamani Williams and I put together a letter when we connected with our colleagues across America who saw the same things happening in Black and brown communities all over the country. And we stated that there should be a Department of Justice investigation, that we should look into the civil rights violation of Black and brown people in this country. Now let's fast forward to the vaccine. I spoke with the Department of Health January 3rd, gave them a 7-point plan and told them they need to do the vaccinations in real time. Why were we filling out this in a form? We could have used handheld devices, identify how we were trending to make sure we did not give out 900,000 vaccines and say, oops, we forgot Black people. This is either incompetent, at least, or racist at best. And we must have a real-time plan to ensure that we have credible messengers, clergy leaders, organizations to communicate with people to understand the safety of the vaccine. And we must do this in real time. You can't continue to run a system in the 1930s and what we in the 2021. We could do it better.
Thank you so much. Moving to Amaya Wiley.
Whew. So thank you. Let's just start with the fact that there was no surprise here because we knew from testing that we were not getting sufficient support and testing opportunities. And we knew months in advance that we were gonna have a vaccine. And one of the things we should have learned from the testing, and we certainly should have learned from the fact that 88% of the folks who are dead, who we have lost because of COVID, we lost in certain communities that look like us. And so one of the things we also knew was that some of our strongest partners are our community-based organizations because they're trusted, they know where folks are, and even without those handheld devices and all the fancy equipment, not that I'm not for that. I was proud to help get every single unit in Queensbridge houses free broadband when I worked for New York City government, showing how to do something I had never thought about doing it before. But here's the thing, even without that, we have relationships, we have trust because we have community leaders and community-based organizations that have built it. Bethany Baptist Church got 500 people tested in 2 days after begging the city to let them be a testing site. But so that planning for community-based organization, faith-based community leaders, all of our local institutions in hard-hit communities should have already been part of the plan, asked what they needed, and been organized and supported to make sure that our folks got vaccinated. And it did need to be a geographic approach that understood that it is the relationships that would have ensured that the neediest got it. And that's what I would have done. But before I give up on my time, because I just don't want to let it pass, Andrew, Evelyn is inspirational not just because she's a survivor, but because she is a powerful woman. And we heard the pain in your voice, and we know that you have stood by her, and we thank you for that. And we thank her for her bravery.
Thank you, Maya. Thank you so much.
So much, Maya, and thank you so much for your kindness. Moving to Ray Mcguire.
Listen, this COVID crisis is one that we have known about long before COVID and George Floyd. It has just unveiled the systemic inequities that we've seen in education, in the economy, in the criminal justice system, and now in the healthcare system. It is systemic. It's been longstanding. It reflects.
Ray, you're a little low, at least for me.
Yeah, for me also, Ray.
Thank you. Can you hear me now?
It's a little better.
Okay. What I was saying is that this COVID crisis just reflects the systemic inequities that we have known for quite some time in education and healthcare, in the economy, and in the criminal justice system. We could have planned for this. Part of what this reflects is the fact that we have not been at the table. Black and brown people, Black women have not been at the table. They have been on the front lines. They have been the ones who suffered the most. If you look at the statistics on who has received the vaccine, for those who recently identified, 43% of white people have taken and received both doses, 11% of Black people. We should have educated better. We should have informed the community better. There's clearly a natural and logical and legitimate skepticism when it comes to Black and brown communities over the taking of any vaccine, given the history of this country with Black and brown people with vaccines. We should have relied on those people who could best inform, who could best educate, which is not something that we've done. And going forward, we certainly need to do that. We need to put the COVID clinics into the neighborhoods. We need to take the vaccines into the neighborhood. We need to improve the accessibility. And the other thing that we need to do is what we haven't planned for, which is something that is emerging and going to be in and of itself a crisis, is the lingering impact of COVID. What do we do about those who survive COVID? What systems do we have in place to make certain that we've taken care of those in the community where there are healthcare deserts? Not planned for that yet. And we need to rely on the faith-based community. We need to rely on those people in the communities who can get the word into the communities. And we also need to have the systems that can address what is an acute problem and will become more.
Thank you.
Time.
Thank you. Thank you so much. Diane Morales, would love to hear from you.
Thanks so much. So first I want to thank your granddaddy for his service during this critical time. And I'm sorry that he's struggling so much. You know, I spent the last 2 days helping 300 residents of Bed-Stuy, seniors specifically, gain access to COVID appointments over this coming weekend. And it was really important to me to prioritize equity in this process. So I totally get it. You know, I'm going to start a little bit further back. I think we should have paid people to stay home from the beginning, because we know who the people are that run this city. It's our Black and brown folks. It's our Black and brown communities. We should have paid them to stay home so we could keep them safe. And short of that, for the people that we know we need to have to continue operating the city, we need to prioritize giving them access to the vaccine. And to me, that means making sure that we provide the access to the vaccine to them in their communities, in their, in their homes, bring it to them as much as possible, bring it to them through community trusted institutions that they already have relationships with, whether that be the churches or the local drugstores, or the community centers and the community-based organizations. Make sure that they're getting the information and access from people that look like them, that understand them culturally and linguistically. We should be bringing out mobile vans into the community. We should be providing open access 24/7 to our community members. We know what it takes to get our folks to that. And we need to step up to provide that. So one of the other things that I have pledged to do is in my first 100 days, launching New York City 5,000 across the 5 boroughs in order to provide care and support to our community members in the communities, providing immediate economic relief, providing education and information, supporting with distribution of the vaccine, again, in an accessible and culturally relevant manner, including language, and also providing the mental health and the social emotional support, because we know that all of this trauma is having a disproportionate impact on our communities who are disproportionately on the front lines, serving others and being harmed. Got it.
Thank you. Thank you so much for your answer. Scott Stringer, I'd love to hear your thoughts.
As controller, I have 788 employees that I'm responsible for, in addition to the retirement security of 700,000 New Yorkers. It's a $240 billion pension fund. And we knew when the virus arrived, there were decisions that had to be made, but we weren't sure how this was going to play out. And if you said to me after 30 years in public service, what was the best decision I made? It was being decisive and sending 788 of my employees home. And when I did it, agencies followed. And the reason I did it was because we had to think safety first. But one of the things we knew when we were sending people home was that there was a vaccine in the works. So while we had to make these decisions without full information about the virus, it was inexcusable that City Hall did not have an actionable plan to make sure that we had a plan to inoculate in all 5 boroughs and all communities. It was a moral and managerial failure of the highest order. And I took them on and said, let's get busy. Let's open up 24/7 sites. Let's make sure that we're moving contact tracers as messengers to educate all communities, Black community as well, about this crisis. I stood with Jamani Williams and laid out what I call Fair Shot NYC, that we should develop a single online platform, develop a centralized database, create public education. But quite frankly, City Hall slept through this. And that is not the mayor I'm going to be. Because when crisis comes and lives are at stake, decisive leadership matters in this fight.
Great, thank you. Thank you so much. And Andrew Yang, would love to hear from you.
Thank you, Samaya. First, thank you, Amaya, for the acknowledgement. I felt heard. I really appreciate it. I'm so proud of Evelyn. And her doctor is up on charges now because 40 other women came forward. So thank you. This is a situation where an equitable system will have a clearly racist impact. The fact is, if you have vaccination information out there, Black women, essential workers are going to have lower levels of time, resources, opportunity, proximity, access to internet. And so if you set up a system, it's clearly going to end up disadvantaging the people that need it most. So what do? You don't create an equitable system that you know is going to have a racially uneven impact. What you do is you go to predominantly Black neighborhoods and say, guess what? In this neighborhood, the eligibility age is going to be 45 instead of 65. And you know what? Black people are at higher risk of COVID, so it would be wholly appropriate to do it. Like, that is the kind of thing that you should be doing from day one from City Hall, because you can see very, very predictably that people of color are going to be left out of any supposedly equitable vaccine distribution system. And I am so proud that my campaigns, over 3,500 volunteers starting today, are calling and texting and reaching out to New Yorkers to try and get them the vaccination information. Because we know that people right now are struggling, they don't know where to go, and we need to help them. So we need to be doing much, much more, particularly for the essential workers that have carried us through this crisis at great personal risk. And I know some of you have lost loved ones who are in that description. And we should be acting on our gratitude.
Thank you all for your thoughtful answers. Back to you, Professor Greer.
Thank you, Samaya. So this next set of questions is just for candidates Morales, Mcguire, Yang, and Stringer. And so the question is, if you're successful in this election, you will be sworn into office at a time of great need. Between the COVID pandemic, record number of homeless individuals and families, high unemployment, hard-tied level of school segregation, a desperate need for permanent, truly affordable housing, and so much more. What would be 2 signature initiatives that you would implement within your first 100 days in office? And how would those priorities benefit Black women? So Ray Mcguire, I'll start with you. And you have 2 minutes for this response.
Two signature, number one in my economic plan, which is go big, go small, go forward. I would include in that, and it is a signature program, I would include in that a small business administration, small minority women business owned administrator, deputy mayor, to focus just on primarily Black men, Black women, because if you look at the distribution today, it has been inequitable and they have been excluded. So that would be number one. And as part of that, I would make certain that I would designate $50 million to invest in directly invest in MWBEs. Today, we have construction permits or construction contracts where the goal is 8%. Right now, we get 0.5 or 0.7%. That is not acceptable. So I'd make certain that I would make the investments, and I would do the analogy that I would give you all is one that many of us experienced historically, is what Maynard Jackson did in Atlanta, Georgia, which is no contracts were written, no contracts were agreed by the mayor until they included minority and women business-owned enterprises. And that's the same approach that I would take here. I would make certain that nothing got out unless there was inclusion. And so that would be one signature program. And the other signature program that I would do as part of my go big, go small strategy is to make certain that I got jobs into the community. Jobs, including workforce development. So it's jobs, no city, no dignity. And part of that jobs program is focusing on Black women, Black and brown women, and focuses on getting jobs into the larger community, as well as making sure that we focus on small businesses, which is the lifeblood of the city. So go big, go small, go forward, including Black women, and I would make certain that we got people back to work. That's number one. Number two, I'd invest in technology to make certain that all of our children and all of our families, they 1.5 million don't have access to broadband, don't have access to tablets. I would make certain that we bridge the digital divide. And given my history of having done this, that's what I would do.
Thank you so much. Diane Morales.
Thanks so much. So I would begin to address the current crisis by providing folks with some basic economic relief for every household, especially the excluded workers and those that we know were left out on the federal and state level. I would do that actually by defunding the police, because I have said repeatedly that I think it's important for us to move money away from those that do our communities harm and in fact invest in our communities. So in order to begin to invest in our communities, we need to move that money away from the budget, from the NYPD budget, and begin to provide communities with the services that they need to in fact be safe, because we know that policing and public safety are not the same thing. And so those dollars would support beginning to house everyone who has been unhoused, because we also know that you can't have public safety or public health if people are homeless. So we need to cancel the rent, provide economic relief, provide housing. And the last thing I'll say is that in terms of our economic recovery, we need to prioritize our small and our mid-sized businesses, because we know that small and mid-sized businesses employ 50% of New Yorkers, and that we need to move away from the historic model of counting on big corporations for jobs who come into our communities, exploit our labor, and extract our wealth. So, that's essentially the sort of big things that I would want to do in the first 100 days. And I would start with the budget, because a budget is a reflection of our values, and what we're investing in is a reflection of what we think is the most important thing.
Thank you. Andrew Yang.
Thank you, Professor Greer. I would say 4 things. Number one, we need to amend the city charter to make ending racial health disparities one of the missions of the city. Right now, the life expectancy in Brownsville is more than 10 years shorter than in Greenwich Village or other parts of New York City, and it's wrong, it's unacceptable. We need to commit ourselves to ending it from day one. Number two, I've committed $1 billion in cash relief to the extreme poor in New York City, and unfortunately we know that overlaps heavily with communities of color and women of color. So they will benefit disproportionately from this $1 billion in cash relief, which in my mind is a no-brainer. It's the right move. Number three, I've committed $100 million, which I believe I can get a multiple of from various sources, to lower the 29% of New Yorkers who don't have access to high-speed internet. Data poverty is poverty in the 21st century, and we need to end it And then number 4 is we need to reduce the 12% of New Yorkers who don't have access to basic financial services. We're the world's financial capital. It should not be this expensive to be poor. We can make it so that you keep more of your money. So those are 4 things that I would do in the first 100 days as my signal proposals. I'm committed to them. We can make them happen together.
Thank you. And Scott Stringer.
I would start a little before January, after the November election, and build out the capacity of the new administration, which is key to doing big things. That's exactly what I did as controller with those 788 employees. We built capacity to do the big things over the last 7 years. But one of the things we have to do right now is we have to start going to implement my NYC Under 3 plan. I've laid out a first in the nation plan for affordable childcare to all working families, 0 to 3. De Blasio did it for pre-K. We have to continue this. This will have a tremendous impact on Black women as parents and as providers, because the bottom line is we see time and time again that the investment in Black women, who represent 1/3 of all childcare workers in the city, that we talk about, but 24% of the people who take care of children live in poverty. My plan would end that. We would send 20,000 people, mostly women of color, back into the workforce. And we would also care for our children, 0 to 3. 80% of brain development happens 0 to 3. Second, I would implement my affordable housing plan, immediately give the vacant city-owned land. I would give it back to the people, give it to community-based organizations, and finally build low-income housing. You see, it's not affordable housing, it's low-income housing. Move 30% of the people in homeless shelters who have jobs into housing, take our land, give it to do the most good. We've built more affordable housing for people who make over 150,000 than we have for less than 30. Let's implement NYC Under 3. I would implement our housing plan, but I would build an administration that is diverse, that has tremendous capacity, because part of being mayor is being the person who can show up and get to work on day one. This is not a mayoralty for training wheels. We have to come out of a pandemic bigger and stronger than ever.
Thank you so much. This next set of questions is for Amaya Wiley, Eric Adams, and Shawn Donovan. So the question is, engagements between police and Black communities have been fraught since the creation of slave patrols and the early iteration of current day police forces. Black communities are not a monolith. Some members of our community are abolitionists who seek to defund the police. Others seek police engagement that is steeped in dignity and respect, and many of us lie somewhere in the middle. However, there's a common feeling of fear, outrage, and mistrust of the way police engage with, and some would say target, Black people. What is your public safety plan? Would you cut funding for the NYPD? If so, by how much? Will you commit to hiring a police chief of color? And what would be your mandate for policing during your administration? I'll start with you, Amaya Wiley. You have 2 minutes for this segment.
Well, first of all, let's just start with, I'm gonna put the public back in public safety. And that means a whole bunch of different things. So let me just start with what we said on our gun violence prevention platform, which was the very first that we put out because we listened to Black community. I had a friend whose nephew was shot dead 4:30 p.m. on October 22nd, just going to the corner store. And that's too common a story, and too many Black mothers actually doing community work to deal with their trauma and solve problems. That's a good thing, but they just should never have to do it in the first place. But we are going to take money from the NYPD, and we're going to invest $18 million in a participatory justice fund. That means communities with high rates of gun violence get to say where those resources get spent, what makes them safe. That means they can do things like ask for more funding for their public schools, trauma-informed care for their kids, cure violence model and other crisis intervention models, mental health services and crisis response. That puts the power directly in community and in communities' hands, just like participatory budgeting. But I will put the public back in public safety by being the strong mayor that says it's the public that tells the police what their job is. That means we set the priorities of policing, because what we know right now is, if you look at 13 months of call data, and I am going to get wonky, I apologize. Of 15 million calls to the NYPD through 911, only 2 million roughly are for serious or critical crimes. That means we're paying people to have a badge and a gun for doing things like responding to a fender bender or intervening in a mental health crisis, where what we need is a professional, is someone who knows how to handle that problem so that they don't become Eleanor bumpers. So that's where we take resources from right sizing the NYPD and we put it directly in mental health crisis response. And I will absolutely do that. I will tell you one other thing we've already done.
All right, Maya, not one other thing. Time.
All right, Chatty Cathy over here.
That's right. Eric Adams, you're next.
Thank you so much. This is such an important question, and I'm going to say this over and over again throughout this entire campaign.
Can you just turn up your mic for a little bit, Eric?
I'm going to say, can you hear me better now?
Yes, thank you.
I'm going to say this throughout the entire campaign. The prerequisite to prosperity is public safety, and we should never take that away. My heart goes out to the 4 innocent people who were using our public transportation system. They were stabbed and killed. My heart goes out to the woman who was just walking her dog in Brownsville and was struck several times with a machete. I think it's crucial that as we look at public safety, we must change the ecosystem of public safety. Utilize the dollars to prevent many of the crimes we're witnessing, particularly when you look at 30% of the young men and women at Rikers Island are dyslexic. Let's be more proactive and do dyslexia screening in all of our schools. When you look at that 48% have mental health illnesses, let's be more proactive in doing so. When you talk public safety, you are talking about Black women. We saw the case in Harlem where a Black woman was walking out of a store and attacked, and brutally her eye socket was bit out. We saw what has happened throughout this entire city to Black women around public safety and the lack of response when it comes down to Black women. I know about police abuse. It's no secret I was arrested and beat by police officers, but I also know that we could have public safety and justice. They go together. And I will continue to say over and over again throughout this campaign, the prerequisite to prosperity is public safety, and our Black women need to be safe.
Thank you. And last but not least, we have Shawn Donovan.
Thank you, Professor. And look, this is not theory to me either. Eric talked about his very personal experiences. I've worked with mayors and police chiefs around this country to reform policing. And I know that we can do it if we do 3 things. We need to reimagine policing. We need to make sure that we're reducing the role of police and that we're taking the savings and reinvesting it and into our communities. Those 3 things. And if we do those three things, I think we can put the justice back in criminal justice as well as the public back in public safety. Reducing the role of the police requires that we focus them on guns and violent crime, not on patrolling the hallways of our schools, not on criminalizing homelessness, and not on the so many things like parking tickets and others that Maya described. I absolutely agree with that. But we also need to reimagine policing. We have to create real transparency and accountability. We have to completely transform the way we respond with an alternative 911 that ensures that we're sending out trained professionals. My sister was a psychiatrist who worked on a street team with the homeless. I know that we can change the response. We've done it in Oregon with Cahoots. We've done it in other places around the country. We can do it here. But lastly, we also have to think about this not just as a policing issue, but more broadly as a criminal justice issue and the underlying public health crisis that is facing so many communities. We spend today more than $400,000 per prisoner per year at Rikers. I worked with President Obama to close the most expensive prison in the world, Guantanamo. Rikers is the second most expensive when we get bad results. We need to reinvest in community-oriented solutions like NEON that actually break the cycle of incarceration. I would dedicate within my first 2 years as mayor, $500 million a year to that. And by the end of my first term, $3 billion a year, 20% of our entire criminal justice budget would go to reinvest in communities and end the cycle of incarceration.
Thank you so much. So next up, we'll have one of our Community Voices Heard members, This question is for all 5 candidates. And so, Marilyn, Jamie, are you here?
Yes, I'm here.
Okay, thank you. Welcome.
Thank you, Professor Greer. My question is related to housing. My name is Merlin Jamie. I am a CVH and a second of Florida's Derecho a un Techo, Right to a Roof member. I was born in the Dominican Republic and have been living in New York City for the past 32 years. My mom, a single mom of 3, had a dream to provide her family with a decent home and to own that home. In 1995, my mom and other community members met Our Lady of Lourdes Church, and a year later became the legal organization by the name of First Lord Florida's. They discussed and battled major problems within the immigrant, Black, and Latino communities. Problems such as the inhumane, overcrowded conditions and the affordability within housing in New York City. In 2001, 15 families achieved the dream of becoming homeowners and still are. Seeing my mom struggle as an adult, I was compelled to continue that fight by joining Second Lord Florida's. We began meeting in February 2015 as the second phase with the dream of becoming homeowners. During the COVID pandemic, we Black and Latinos were the most affected, not being able to pay rent, not having adequate homes to quarantine, and some even becoming homeless. I have a 2-part question, and I will start with Scott Stringer. As a mayor, what program would you implement so that working people from the middle and lower classes, like our group, can be homeowners of cooperative apartments, not just affordable housing and rental? And the second part of the question is, will you agree to do a session with CVH's NYCHA Vision team to hear what their plans are for public housing?
Well, let me just say that the housing plan I've announced, which is universal affordable housing, and taking our city-owned vacant land and returning it back to community-based organizations, was in part with the consultation of CVH and AFIA, because we all agree that we need to sort of flip the script on developers and speculators and build more opportunity for home ownership. But this is my specific housing plan. And I know the developers are not happy with this, but this is how it's going to go down if I'm mayor. First, we're going to give the vacant land, over 1,000 properties that the city owns, we own. We're giving it to community-based organizations with a new subsidy to build the actual low-income housing we need. The truth is, the Bloomberg and the de Blasio rezonings were about making sure developers did well, but we built unaffordable housing. That would change. Second, when it comes to as-of-right development, no more luxury buildings without affordable housing. And I would implement that as well. We have to end displacement rezonings, where we go into communities thinking that we're selling neighborhoods, especially in communities of color, a bill of goods because this housing that they're building is not affordable. But also we have to improve Black ownership by helping renters grow their credit scores with their rent payments, because you know that right now, 4 Black women are denied mortgages and they have to pay higher mortgages due to discrimination. We can change that with credit histories. I have a proposal for that. And also on NYCHA, of course, I'll sit down again with you on NYCHA. As the controller of New York City, I've audited NYCHA 15 times. I've looked at the stairwells, the lack of repairs, the boilers that are broken, the lead paint in children. I know on day one as mayor exactly where to go to build the affordable housing, make sure we have properties that can build it, but also create a real plan for NYCHA. It's called management, it's called finding the dollars, and it's also called accountability. And we have to do that. Look, Marcia Fudge, the representative, is at the help.
Time, Scott. Sorry about that.
Okay.
Let's continue, please, with Shawn Donovan.
Thanks, Merlin. And first, absolutely, I will sit down with you again. As you know, about a year and a half ago, I joined with AFIA and all of you to bring together leading proponents of change for public housing, some of the best folks around the country, to meet with residents. And I will do that again and again. Call me, whatever. I am ready to meet again. So that's the first thing. Second, I found your story really powerful. We talk so often about gentrification in this city, about people being pushed out. I think we're witnessing in many ways the second great Black migration in this city. The first great Black migration was into our cities. Now Black folks are being pushed out, and that has to end. And building homeownership and wealth is one of the most powerful tools that we have. I learned that from Bishop Johnny Ray Youngblood 25 years ago, as I talked about. And it's a lesson that needs to be brought back now. This city has forgotten about homeownership as a tool towards wealth building. And so first, I would bring back the efforts to create not only single family, but multifamily. You asked about co-ops. I've proposed a citywide inclusionary housing program with a home ownership opportunity, and we can keep housing permanently affordable and still allow real wealth building if we design that program correctly. I'm the only one who has a design for it. We absolutely need to do it. And we need to be investing in both housing counseling at a significant scale to make sure that we are building the financial knowledge and the savings to be able to successfully be homeowners, not just to buy, but actually to thrive. Lastly, I would say we shouldn't just be looking at homeownership as wealth building. I have a landmark proposal called equity bonds. It builds on the remarkable work of a great Black woman, Ayanna Pressley, who's a new Congresswoman. What I would do, every child born in this city would get $1,000, depending on income, every year, $2,000 more. A child born into poverty would graduate.
Sorry, Shawn, that's time.
$1,000 to buy a home.
Thank you.
Business. Thank you, Professor. You've got a tough job. Thank you.
Thank you. Let's continue with Diane Morales, please.
Hi, Marilyn. Thank you so much for sharing your story. I'm going to start off by saying that I've made a pledge not to accept any real estate dollars. And so I think that allows me the flexibility to be unapologetic and unabashed about whatever real estate policies I put in place moving forward so that we can truly move towards equity and justice for those that have been impacted the way you and your family have. And the other thing I want to say is that, you know, my heart actually goes out to the 4 victims on the A train this past weekend. And that in terms of housing, any equity moving forward has to call for us acknowledging that the alleged attacker was also homeless and had mental health issues rather than criminalizing immediately and recognize the extent to which we criminalize the poor in so many more ways than one. In terms of housing, one of the things I've been talking about for the longest time is that I would shift the over-reliance that we have had historically in terms of the housing framework that we have on developers and a developer-led for-profit model. And I would instead focus on community-led planning that would increase and be focused on the increase of social housing, the increase of cooperative housing, which is what you're talking about, and the increased expansion of community land trusts so that we actually begin to truly center our communities, our Black and Brown communities in leadership around housing. I'm going to enforce housing as a human right for every New Yorker so that it becomes clear that it's more than just the language of the New York City Charter, because it is in fact part of the language of the New York City Charter already. So it's not just words, it should actually be realized for our communities. Sorry, I got thrown off by the 30-second warning. And so, you know, I also think that we need to prioritize getting housing for everybody, right? And moving away from this shelter-based system to a system that moves to immediately providing permanent affordable housing for everybody. And that means if we have to exercise eminent domain, if we have to be flexible about zoning of spaces so that we can repurpose them, commercial spaces, office spaces, hotel spaces, we're gonna provide housing for every New Yorker that they can be proud of so that they can live in dignity.
All right, thank you for that answer. Let's continue, please, with Ray Mcguire.
Yeah, thank you for that question. Let's dissect where we are here. What you're describing in terms of ownership is the goal that we all aspire to. Where we are now is we have renters, and we have many of the undeserved who pay 50 to 60% of their income on rent. And when the rent moratorium eviction goes away, we're going to have people we have to deal with. So one, I would extend that. I would make sure that they have access to the vouchers so that they can stay in their homes and make sure that they can continue to rent. That's number one. For the current homeowners, the objective is to make sure that they can stay in their homes and so and we protect the value of those homes. Right now, the values of many of those homes are getting threatened. The third one is home ownership, to which we aspire. On the first three, the way that we have to look at this is, first of all, you need jobs. And part of my plan is jobs in order for people to pay the rent, in order for them to buy homes, in order for them to stay in their homes. Jobs to give people the income so that they can afford homes, so they can move from no class to middle class, which is home ownership. And I've written about the inequities that have caused the crisis that we have in home ownership. It is a goal to which we should all aspire. And I've had a track record of making certain that people get to the place where they have a home ownership for the past 36 years or so while I've been in business, making certain that they could derive the kind of income that you've described so they could actually own a home. If you look at the ownership of homes in Black neighborhoods versus white neighborhoods, it is a fraction of that. So if there's anything in which we need to aspire, it is home ownership. And I'd be dedicated to making sure they get the jobs to afford the homes and also the infrastructure in place so they keep the homes and the values of those homes continue to go up.
Thank you. Let's continue, please, with Eric Adams.
Thank you very much. And I keep saying over and over again throughout this election and campaign that it's the Esther moment for 14. God made me for such a time like this. My experience of growing up in South Jamaica, Queens, carrying a garbage bag full of clothing to school every day because mom thought we were going to be thrown out by the marshals. And she did not want us to be embarrassed by not having a change of clothing. It just shaped my concept of what we must do when you talk about Black women around home ownership. And it's important. It's not just renting. It's about finding a pathway to home ownership. That's why a borough president, as the borough president, we've held a number of first-time home buying seminars. We've held a series of financial literacy programs to show people how to navigate the complexities of filling out a mortgage, finding a home that fits your income level. But we also believe we need to reinstitute things like the TIL program that took buildings and allowed tenants to take over those buildings and create some form of cooperative. The idea was that the city will assist a tenant association in making this conversion. It is clear that we have done a terrible job of reinstituting programs like the Mitchell-Lama type program, which has been a stable and the anchor in many communities during some of the most difficult times. And we should even look into the possibilities of showing how we can build the way we ought to. We have been doing our development incorrectly. We have been displacing poorer communities, but instead we should be developing in affluent communities with great access to transit, great schools, great access to healthy food, and allow poorer people to move into those communities. Lastly, it's about low income, but also it's about middle income as well. We've decimated the middle class in the city. Many of our teachers and accountants and other middle class can't make it happen now.
Thank you. You mentioned two good programs from the past. We should bring it back. Let's continue with Amaya Wiley, please.
Well, thank you. Look, as a civil rights lawyer, racial justice advocate, home ownership and the loss and theft of homes is an issue we also have to talk about. So I am with so many of my colleagues in that we have the opportunity now to build on the programs also from Mitchell-Lama, which I lived in as a baby and which helped get me through law school when I was at Columbia, living up in Harlem, and that co-op model and the city financing the construction of more of them. But also we have to do much more. So as I said, we've already got Black homeowners having their homes stolen, literally 3,000 a year thanks to deed theft. So we have to do what we've done in other instances, which ensure there's legal support and representation, but also ensure that we're building up community-based organizations, both for the education and support to prevent the scamming, as well as the enforcement to prevent the home loss when it happens. But we should also talk about the other thing that folks don't like to talk about, which is that if you are Black and own a home, you're probably paying too much in taxes for it. And folks who have much more valuable homes pay less than their fair share. So you're underwriting them. So we actually have to have property tax reform as well. That process is underway, but I would continue it and see it through to its end, because the only thing I need to do besides stay Black and die is make sure that we do the hard work that needs getting done and not worrying about the politics of the usual. but making sure it's a path for the people. So I absolutely will walk that path on NYCHA planning. I already have $2 billion in a $10 billion New Deal for New York, which will create 100,000 jobs, because if people can't afford to buy a home, it doesn't matter if you create the program, and they're going to be high road jobs with local targeting. But $2 billion will be earmarked for NYCHA, for renovation and rehabilitating. And I won't need agreement from Albany or dollars from DC to get it done. My plans are ones that I can do as mayor without that permission.
Thank you. And last but not least, Andrew Yang, please.
Marlon, congratulations on your awesome activism. You got started in 2015 and you're on your way. You're highlighting a crisis that we all know has been unfolding for years and decades and generations in New York City, where you have an affordable housing crisis. You have people who are for affordable housing in the abstract, but when it's in their neighborhood, they say no. And the people that are left out in the cold the most are going to be people of color and women of color. So what do we do to change it? Number one, right now, most women of color are renters, and you have rampant abuses among rent-stabilized apartments and landlords overcharging tenants to the tune of hundreds of millions of dollars a year. There's a nonprofit that identified $100 million in fraudulent charges, and we know it's a multiple of that. So number one, you have to enforce those rules and see to it that renters actually are keeping the money that you should have and be able to grow savings towards owning a home. The next thing we have to do is actually develop more affordable housing. But I'm going to suggest to you all, I am impatient. What do I mean by that? It's like, we don't have time for this stuff. And right now, if you look around, you have massive empty hotels. And you know who's buying those hotels? BlackRock. Because right now, the private equity firms look up and say, ooh, distressed properties, let me pick those up. You know who should be picking those up? The city of New York. And we should be relaxing some of the zoning regs, because right now we have occupancy rules around apartments saying, hey, you need a kitchen. Like, I'm going to suggest that right now we're in a crisis. We should be converting some of these hotel units and say, what, they don't have kitchens? I think we'll survive. You know, you can have a communal kitchen. We should be relaxing the rules around how these housing developments look, to include co-living, to include micro units, to include communal living arrangements with a central kitchen that I have a feeling a lot of people would enjoy anyway. You know, like if you come together for meals, I actually think a lot of New Yorkers would enjoy that. So we should be more impatient about this. I'm for community land trusts. I'm for cooperative housing developments, but we have to move faster.
Thank you so much, all of you, for your answers, and I look forward to meeting with you with CBH and the NYCHA housing, the NYCHA vision team. Thank you so much, and have a good night.
Thank you, Marilyn. So this next question is for Shawn Donovan, Eric Adams, and Ray Mcguire, and it comes from CBH member Laurie Fisher. Welcome, Laurie.
Thank you, Professor Greer, and thank you all for your wonderful questions so far. I am a young New Yorker and also looking forward to possibly being a homeowner one day, so I really appreciate your question, Marilyn. So my question is, so I moved here from Jamaica when I was 8 years old, and I remember my mother, who was an audacious, still is, an audacious woman, an undocumented immigrant. She struggled with my school and the Board of Education because they felt that as an immigrant child, I inherently wasn't smart enough to start in the grade I was supposed to be in. Eventually, after a whole lot of fighting, I was put in the correct grade. I often wonder how things would have been different if I had been placed a grade behind. What would the social impact have been for me? How would it have affected my psyche to feel like I wasn't good enough? Or how would it have impeded my progress to feel like I wasn't good enough just because I moved to a new country? So prior to becoming an attorney, I worked with students in Black and Brown communities, some of which had very similar stories to me, and some of whose parents couldn't win that fight against the school or Board of Ed. I have discussions with my teacher friends whose immigrant students are not given proper support because the systems in public education as they are too overwhelmed to provide supports to students outside of ESL. So my question is, what will you do as mayor to ensure that immigrant children are given the proper support needed to succeed in the education system? And I will start with Mr. Adams.
Thank you so much. And that's such an important question. And let's be clear, our educational system is clearly, it's broken. When you look at the fact, and I want to always go back to that, we don't identify crises when it's dealing with Black and Brown people. 65% of Black children don't meet proficiency every year. Think about that. Not one year, but every year. And then when you have immigrant children that come here to this country and they walk into the Department of Education with their parents, and some may have English as a second language, Creole or French, or some may just need the necessary support, or some are dealing with children with special needs, such as what Lucina Clark from My Time Inc. has been attempted to navigate. We have a school system that is broken. And as the mayor, I'm going to do several things immediately. Number one, you hear it over and over again. People keep saying that education is from 0 to 3 or K through 12. That is just wrong. And I'm going to continue to highlight this. The first classroom is in a mother's womb. The first classroom is in a mother's womb. If that mother is not receiving the right support for doulas that I'm going to ensure every newborn mother receives, if she's not receiving the right iron, the right folic acid, the right iodine, that child will have irreversible educational issues. And then when you move into the K through 12 model, I'm going to make sure that we have a diversified school body and staff that will help those children who are coming from the Caribbean, from South Central America, that they will have the support to navigate through the system and give the needed support that they deserve and I appreciate they should have.
Thank you, Mr. Adams. Mr. Donovan?
Thank you, Lori. I'm inspired by your story. Congratulations on becoming a lawyer, staying the course. I'm also inspired because I'm the son of an immigrant who grew up in Costa Rica and Lima, Peru, spoke Spanish before he spoke English, came to this country as well to find opportunity. And I fundamentally understand that we have to fix our school system to make it more equitable, but there are many other things that we need to do as well. So let me focus on schools first. We have to understand that right from the very beginning, we have built-in disparities in our school system that go to the way we test and screen and so many other things. I have the most extensive, comprehensive plan to reverse that discrimination, not just against immigrants, but against Black and Brown people more broadly. But we specifically need to go beyond that to ensure that we're creating 450 new dual language programs across our schools. We need to fundamentally change the recruiting of our teachers, because what will change this most is having teachers that reflect our communities, including our immigrant communities. Right now, we have 42% teachers of color in a system that's 86% students of color. That has to change. And I've made a specific commitment to doing that at CUNY and elsewhere, building the training programs and others that we need to pursue. So all of that is in the school system. But beyond that, we also have to change the underlying conditions that lead to inequality for immigrants. We have to give all immigrants, regardless of documentation status, the right to vote. We need a true public option that provides healthcare to the 300,000 undocumented folks who don't have health insurance right now. And we need to make sure the entire city is oriented to provide services in culturally appropriate and linguistic ways.
Thank you, Mr. Donovan. And I really appreciate your discussion around changing the way the teaching force looks like, because I know a lot of times I've also seen that a lot of people who come into the system are teachers who are not necessarily from the communities they're teaching and not necessarily qualified culturally to understand what the students are going through, either from programs like Teach for America or whatever. So I appreciate looking into that. And last but not least, Mr. Mcguire.
Thank you. As you know, education is what got me here. Through the sacrifices of my mother, I was able to get a good education. So it is personal to me. And what I want my approach to here and my goal is to make sure that every child, especially those who look like me, get the same opportunities through education. And my plan is what I call cradle to career. Pre-K is fine, but often when our kids arrive at pre-K, they're already behind. So I want to start at 0. I will make sure that as these children are developing their learning, and we need to invest in affordable childcare, and also to make sure that the parents get the care. So from 0 to the end of the 3rd grade, by the end of the 3rd grade, I want to make sure that every child in New York City can read and do math. Why is that? Because between 0 and the end of the 3rd grade, our children are learning to read. After that, they're reading to learn. I want to make certain that I want to be held accountable that every child in New York City can read and do math by the end of the 3rd grade. And then I want to start in the 6th grade to expose them all kinds of opportunities. Whatever it is that they want to do, I want to expose them. There's a great program in Brooklyn called Brooklyn STEAM at the Brooklyn Navy Yard where our children get exposed. And that exposure means I'm going to have a public-private partnership to make sure they have summer jobs. So from the 6th grade to the 12th grade, they have summer jobs in whatever career path they decide to choose. So by the time they graduate, and I want to increase graduation, they get to choose one of 3 things. They can go into a career and a job. They can go to a 2-year or 4-year college. So I need to be responsible for not only what happens pre-K, but for what they do when they graduate. And I want to make sure my cradle to career plan does just that. It ensures education. It ensures making certain that they get a job and they go into the workforce and includes the workforce of the future. And we need to begin to invest now. There are examples which we can follow, and there are examples where I have invested to make certain that education becomes the highest priority for our children so they can have the same opportunities that everybody on this Zoom call and everybody in this race, same exact opportunities that they've had.
Okay.
For your answers. Back to you, Professor Greer. Sorry about that.
Okay, thank you so much, Lori. Our next set of questions will come for Diane Morales, Amaya Wiley, Andrew Yang, and Scott Stringer. Comes from CBH member Santa Soriano Vasquez. I want to remind the candidates to please continue to center Black women in your responses, and you will have 2 minutes to answer this next set of questions. Thank you.
Hello, everyone. Again, my name is Santa Soriano, and I'm a member of CBH Power. My question centers around an area that, first of all, thank you for all your answers to housing, health, and education. But also, you know, we know that Black and brown women also come with assets. Many Black women are business owners, and that's where my question was centered tonight. They're business owners, they're hiring people of color in their communities, and that's what my question is about. So my question starts with my mom, like many of us. My mom has been a hairstylist since I can remember. She had 3 daughters and she needs to do her hair. She said, I need to save money, right? And when we came to this country, working at a hair salon was a good opportunity for her to earn a living and help with the expenses for the household. So for over 25 years, my mom has been working for her salons, and she has been able to provide a stable income for herself and the family. Unfortunately, since the pandemic started, my mom has not been able to work because of safety concerns and lack of sufficient work. As you may guess, there's not enough customers. People are staying home. People are doing what they should be doing. They should be staying home. They should not be out there, right? But that's not good for the business. Hair and nail salons may not be the places that come to mind when we are talking about small businesses. But I do hope that in New York City, this industry is primarily represented by immigrants, Black and brown women. Many of them are business owners, as I said before. Since March, many hair and nail salons have closed or are struggling to stay open, provide a safe place for their workers and their customers. My question is, what should the mayor be doing right now? What do you think the mayor should be doing right now? And what do you plan to do if you get elected to help these small businesses fully reopen and thrive? Which city agencies would you entrust the task to carry it out? And this question is for 4 candidates: Andrew Yang, Diane Morales, Amaya Wiley, and Scott Stringer. First, Andrew Yang.
Thank you for sharing that story, Santa. I ran a small business in New York City, and I know that small businesses are the lifeblood of our communities. They employ the majority of workers here in New York City. And we know, as usual, that women of color are being hardest hit by this crisis. I have already declared that we're going to have a small business recovery czar who is tasked with helping 15,000 small businesses reopen. Right now, if you're a small business, you're hearing from the city about whether you're complying with various regulations. We need to be a partner in helping people stay open. I'll give you an example that may not fit the salon profile. We should be buying space, we should be buying heaters, dividers, and air filtration systems in bulk and helping restaurants who want to stay open make use of them. Instead of saying, hey, like, do this, do that, it'd be like, we are going to be a partner for you and help you. Tomorrow, I'm going to be making an announcement of People's Bank of New York, because the fact is, minority-owned businesses have a harder time accessing capital. They're considered more risky by traditional financial institutions. So the People's Bank of New York will guarantee a certain level of risk and then free up a lot of capital from community development financial institutions and other lenders to actually make capital available to your mom's business, to businesses in your community. And the last thing is, the city is a massive buyer. We all know that right now, too small a proportion is going to Black-owned women businesses. The primary beneficiaries of the NWBE category are, frankly, white women-owned businesses. So what we have to do is we have to actually tailor these billions of dollars that the city is spending even in a down year and have more of it go to communities of color and women of color. It is pretty straightforward. We can do it. We just need to choose to do it. And that's the way I would be leading as mayor. But I love small businesses because I have run one here in New York City, and we need to do much, much more for you.
Santa, before we go to our next candidate, I just want to acknowledge Eric Adams has to leave for a previous event. So thank you so much for joining us on behalf of CVH. We really appreciate your responses. Good luck on the campaign trail, and I'm sure all of us will see you at another forum soon.
Thank you.
Sorry
You
about
did
this.
an amazing job with time. Love you.
Okay, have a great one. Santa, I'm sorry. Go ahead. And now we have Diane Morales is next in your queue, Santa.
That's okay.
Oh, you're muted now.
I was just gonna say Diane. Diane Morales is next on the question.
Thank you, Santa. So, I have to just start off by saying, the greatest asset of our city is our people. And we also know that Black women have always had a much higher rate of participation in the labor force than white women. Despite the fact that we actually have had much higher unemployment rates, a higher share of Black women are employed. And what that's, I'm talking about as workers and as business owners. And so, I think one of the things that is critical for me and that I have advanced is the idea of a solidarity economy, Solidarity NYC, to really sort of focus on investing and prioritizing our communities that advance social profitability and opportunities in our communities. And so that includes investing and growing our small businesses, increasing our NWE participation with micro-targeted strategies that provides education, information, technical assistance, and resources to our Black, brown, and immigrant women that connects them to what they need in order to operate their businesses. But also, we need to talk about how we protect our women, our workers, and our business owners. And I think, we need to extend full protections to all of our workers with the full breadth and weight of the law. And that includes the Fair Labor Standards, Social Security protections, unemployment insurance protections, all of the things that were left behind from so many of our business owners during this period of time, so that they actually have the ability to continue to survive during this pandemic, what you're talking about. And I've already said that we should be paying people to stay home and providing them with a basic income, and then supporting them with incentives and subsidies so that they can get back on their feet on the other side of the pandemic.
Thank you, Diane. Next, it's Amaya Wiley.
Thank you. Hey, Santa. So let me just start by saying, when COVID hit, me and a group of my neighbors understood because people like my daughter, who was worried about Miss Althea, because Miss Althea owned the beauty shop where she went to Miss Nydia to get her nails done. And it was a community business. It was a Black-owned, woman-owned business. And we know Black women as entrepreneurs are 42% of new businesses in this country. But we also saw more shrinkage during recession of earnings. That's before COVID, so there's no surprise that we get hit hard. But we organized a volunteer network because we wanted to make sure the Miss Altheas, our beauty shops, also our barber shops, our roti shops, all the little micro small businesses, as they're called, would actually understand and know what resources and benefits would help them keep going through the pandemic. And let me just tell you something, Santa, that you already know. The programs were not designed for the business models of our beauty salons, because our beauty salons, is Miss Althea, she owns the shop, means she's the person on the lease that rents the space, and then she's renting the booths to everyone else, and the programs all treated each one of them as a solo proprietor. And not what that was for payroll, not for rent. And Miss Althea's problem was rent. And the problem for every single one of the technicians was they couldn't work, as you know. So first of all, we have to recognize, if we're going to save our beauty salons, because I heard that is your question, we need to save all our small businesses in our Black communities. And so many of them are women owned. But what we have to recognize is not a one size fits all, because it depends what the business model is. So for our beauty salon, that means programs to fit the rent, pay it, and keep them open so that they can come back when they can reopen.
Thank you, Maya. Next is Stas Stringer.
Well, thank you for the question, Santa, and thank you for your collaboration, you and your organization, about our affordable housing plan. It is very appreciated. Look, let me just put it out there about what a mayor can do on day one. First of all, recognize that we've already lost 2,800 small businesses. We've lost so many immigrant businesses, and we need to create a tax break and a tax incentive for businesses to go into vacant commercial corridors. And we must ensure that we give them that investment. But there's a bigger issue as well that goes beyond the small businesses. It's about wealth creation in all of our communities. And right now, the city spends $20 billion on women and on procurement. We hire law firms, accounting firms, food vendors. We hire all small businesses, and just 5% of that spend goes to MWBEs. As controller, I took my spending on MWBEs from 13% to 50% over the last few years. And I did it because I hired a chief diversity officer, something the mayor refused to do. 82% of certified MWBs are still not getting city dollars. And as day one as mayor, we are going to action a plan to make sure that we boost spending with MWBs. This is critical to our recovery. We have downplayed this. We have not been aggressive. Agencies have slow walked MWBs. And while procurement is not an issue that people will turn out for en masse, I can tell you that $20 billion of spending without a chief diversity officer in our city agencies is absolutely outrageous. And it's keeping our small businesses of color, Black women-owned businesses of color, they're being kept down because the city is not doing this work. And if I have 20 seconds, I just want to say that as in talking to a young woman who is a consultant who said she works for Nike with a contract, which is very prestigious for a young woman of color, and she's very proud of it. She said she couldn't get a contract with any city agency. I got a problem with that, and as mayor, I won't tolerate it.
Thank you all for your answers. I would just add that let's remember that not all businesses are the same, and they don't qualify for all programs that the city have created so far. And I'm just gonna pass it back to Professor Greer. Thank you.
Thank you so much, Santa. This last question is for all the remaining candidates, and you will have 1 minute for your responses. So please, I beg of you, be succinct since we're slightly over time. Our moderator or our CDH member for this particular set of questions is Miriam Muhammad. Welcome, Miriam. And please, for our candidates, you have 1 minute to respond, and the mute button will be in effect.
Thank you, Professor Greer, and thank you to all the candidates for being with us tonight. As mentioned, my name is Miriam. I, by day, work at Planned Parenthood of Greater New York doing government relations. Also an organizer in the Bronx and a representative of the growing and thriving African community in our city. I'm also a CUNY alumni, and so my question is around support for CUNY institutions. Again, as a CUNY alumni who attended CUNY institutions for both undergraduate and graduate studies, I have seen and felt the impact of continued divestment in CUNY on both the state and city level, and the reliance on increasing student tuition and fees. As a Black woman, I relied on the low-cost tuition and the high-quality education CUNY offers to complete my studies. What are your thoughts on this, and how, as mayor, would you ensure there are no more budget cuts, curbs and budget cuts to CUNY institutions and address the rising cost of tuition? And we will start with Andrew Yang.
Well, congratulations. I feel like you, Miriam, are an emblem of what the city education system should be, where someone should be able to get a quality education at CUNY. It sounds like you got a graduate degree as well. The problem is that CUNY is like a lot of other public institutions where it's creeping up in cost, despite the fact that we know it has immense value. So we need to be attacking that problem and make sure that CUNY is affordable for everyone moving forward. It's a massive public good. I have family members who graduated from the CUNY system. It's a jewel of public education, and it's something that the city needs to be investing in as a massive competitive advantage, which it is. Someone should be able to get a quality public education all the way through here in New York City and emerge debt-free. So this is something that we have to work out with Albany to some extent. There may be some money coming in even from the feds, but we need to be very, very diligent about preserving this as the emblem of opportunity for the work that it is. Thank you.
Thank you.
Next, we have Amaya Wiley.
Well, so look, I'm going to be very quick. CUNY, we must have CUNY. Our people need CUNY. It is what actually helps folks make a future, and that is dignity. We had a People's Assembly committed solely to the issue of CUNY in this campaign. And so we're working on that as a policy model, but tuition should be free. We certainly support the free tuition movement. That means we do have to work with DC to make something real for us. I support Invest in New York, which will also create more revenue for us to invest directly in CUNY, because we will not create more opportunity if we don't do that. But also as part of our New York New Deal plan of $10 billion in capital construction, we're looking at how that also helps CUNY, but all we align our workforce development dollars to also invest in CUNY to help people get some of the benefits of the programs that we're going to be able to invest in through New Deal New York. One last thing, we're going to put $5,000 in 100,000 families' pockets to recognize that it is our caregivers that need taken care of, and that will help with CUNY.
Kathy Wiley is your new name.
I'll own it.
Miriam.
Ray Mcguire's next.
Listen, CUNY, we have underinvested in CUNY. Over the past 3 to 4 years, we have taken dollars away from CUNY. At best, we've kept them flat. CUNY is, as far as I think about education, the epicenter and the workforce of the future, in the New York City of the future. In my plan, CUNY will be the epicenter, the focal point of the technology world. And I want all people to think about CUNY the way they think about some other institutions in other cities. And I want it to be the hub. And I want to invest in CUNY. Tuition is one thing, but you need to invest in the entire curriculum of CUNY. Make certain that you got the right professors there so that they can give you, once we've made certain that you could afford it, so they can give you the best education. And CUNY has historically been one of the greatest educational institutions that exists on this planet, and we need to return it to that status. And I would do just that. Invest in CUNY.
Thank you. Next, we have Scott Stringer.
Well, I'm a proud CUNY graduate, and CUNY is the aspirational institution for immigrants, for people of color, for kids who grew up in New York City. And specifically, we have to change the paradigm about education. Black women have the highest attainment level in education, but also has the highest education debt. And that's something that we have to eradicate, because a degree is only good if you can get a job that can pay the bills, pay the rent, and offer upward mobility to middle class and beyond. But that debt is crushing our Black women and people of color. That has to change. I also think we should take advantage of the structure of CUNY and make community college free so that we can begin to create a worker program that will allow people to do real job training for the post-pandemic economy, in telehealth, in IT. CUNY is the natural place to go to upskill the workforce, not necessarily with 2-year degrees, but simply with certificates or micro certificates. This is a program that I would implement day one as mayor.
Thank you. Next, we have Shawn Donovan.
Thanks, Miriam. Let me begin by saying my first term as mayor, we would make all community colleges at CUNY free. How do I know we can do that? Because I actually led the strategy as President Obama's budget director that created the proposal for free community college. No one can work better with the Biden-Harris administration or our leaders in Congress to get us the help that we need to do that. At the same time, I believe that every income qualified student should be able to get through CUNY free. I don't think my own sons or others that have the resources should do that, but I think we should have every income qualified student be able to graduate without any debt at all. So that's my commitment. But we also need to make sure that we're building on CUNY being one of the jewels of our public education system. I've committed to creating the New York City Job Corps, the biggest commitment to apprenticeships that the city's ever seen. And that would be a huge opportunity for CUNY students as well. And let me just give you one particular example. We know our kids in our public schools are suffering after this year of COVID, and it's not just academically, it's also emotionally, the trauma that they've been through. I've proposed to create the New York City Education Recovery Corps with CUNY students to make sure we're putting young people who have the potential to be teachers, to reflect better our communities, to actually be able to go to work, helping our kids recover both academically and emotionally.
Thank you. And finally, we have Diane Morales.
Thanks so much. So, I just want to start off with acknowledging one thing. I don't think it's a coincidence that CUNY, like NYCHA actually, the disinvestment in the system started when the ratio of Black and brown students to white counterparts started to get a little bit too high. We need to recognize that CUNY is in fact a public treasure, and I have committed to the idea of creating a K through 16 free system for all of our students in New York City. That also includes supporting our adjunct professors, because we know that they're the ones that are also bearing a significant brunt of the challenge right now. And I'm not just talking about community college, I'm actually talking about all of CUNY. In a solidarity economy, which is the core, one of the cores of my platform, we would actually build on the care model, and CUNY would be the critical center where we could incentivize the labor force that we need to recover. We need to reclaim CUNY as ours. And I've also spoken that I am unabashed about taking on the forces and the powers that be in Albany and otherwise in order to advocate as an unabashed leader for New York City for what we need. And we need somebody who's going to ensure that we get the resources so that CUNY is available to everyone. And that's what I'll do.
Thank you all so much. And I am going to pass it back to Professor Greer.
Thank you. So now it's time for our lightning round. There will be 4 questions. The answer to these questions is yes or no. I will scramble the order. I'll start with Diane Morales. Do you have an ID NYC?
I do not.
Andrew Yang?
No.
Amaya Wiley?
Yes.
Ray Mcguire?
No.
Shawn Donovan?
No.
Scott Stringer?
Yes.
Second question, I'm going to start with you, Andrew Yang. Who do you like better, Aretha Franklin or Patti LaBelle?
Aretha Franklin.
Amaya Wiley?
Aretha.
Ray Mcguire?
Aretha Franklin.
Shawn Donovan?
I'm going with the crowd, Aretha.
Scott Stringer?
Aretha Franklin.
And Diane Morales?
The Queen. I mean, Aretha.
Okay, Amaya Wiley, I'll start with you for this question. Aside from this forum, have you ever taken part in a CVH event?
Yes.
Ray Mcguire?
No.
Shawn Donovan?
Yes, and I've organized one too.
Scott Stringer?
More than one. Yes.
Diane Morales?
I'm a member, yes.
And Andrew Yang?
This is my first, but not my last.
Okay, and then the last question for the lightning round. How many homes do you and your partner own? I'll start with Ray Mcguire.
2.
Shawn Donovan?
2.
Scott Stringer?
I don't own anything.
Diane Morales.
1.
Andrew Yang.
1.
And Maya Wiley.
1.
Okay, well, I'm going to turn it over to Juanita for closing. I want to thank all of the candidates. You all are super troopers. And thank you so much for answering my questions and the questions of the members of CDH. Afia, thank you so much for inviting me to be the moderator. I'm very honored to work with you in all things.
Thank you,
Let's
Dr.
give it up for Professor Greer.
Thanks for keeping our feet to the fire.
Yes. So my name is Juanita Lewis, the Hudson Valley Organizing Director with Community Voices Heard Power. So once again, want to thank all of our candidates, our wonderful moderator, our wonderful CVH Power members who asked such informed and exciting questions, and the lightning round, which was truly informative. So at this time, want to thank all of you for participating in our first Follow Black Women Mayoral Forum.